Hello, and welcome to AMM Conversation, the official podcast of the Association of Medical Media. I'm your host, Jason Karras. Season 2 of the podcast will explore the new normal in medical media. In this first episode, we have a roundtable of industry experts discussing how medical publishing is coping, adapting, and excelling during the COVID-19 pandemic. Our panelists today are from Healio and its parent company, the Wyanoke Group. John C. Carter is Chief Operating Officer of the Wyanoke Group. Healio Strategic Solutions, Healio Live, and Slack Incorporated are wholly owned subsidiaries of the Wyanoke Group. John's been with the company since 1982. Also joining us is Healio's Chief Content Officer, Joan-Marie Stiglich, a 25-year veteran of medical publishing. She spent the duration of her career with Healio. And last but not least, Matthew Holland, Chief Commercial Officer of Healio Strategic Solutions, where he's responsible for all print, digital, and custom sales operations for Healio. Thanks for joining me. Now let's start the conversation. What's been the biggest challenge the pandemic has placed on Healio and your organization?
So we have about a 60-person newsroom, and there's a lot of road warriors, as John mentioned. But we do have staff that doesn't travel, specifically our copy editing staff, our production staff. So there was certainly some early challenges in terms of being able to communicate cohesively. Fortunately, about 2 years ago, we went to a completely paperless workflow. So not knowing this was going to happen, we were very accustomed to be able to communicate as copy went through from assignment editor to writer, back to the copy editor to who's posting the article. So we were very fortunate in that way.
Yeah, and Jason, in terms of large challenges, sorry, I should have started here, but in terms of big challenges, Healio 5.0 version 5.0 launches next week. So our largest product launch in about a decade has been brought in on time and even a little bit ahead of where we expected. Despite being out for 11 weeks now because of the pandemic. So that's been a significant challenge for a lot of groups.
Yeah, and I was talking to some of the Elsevier folks the other day, mostly on the commercial side, and they actually were raising the flag that the production teams and those folks that do have to do a lot of that office work have been able to just nail it during this time. Have you guys seen any specific teams that have just really stepped up?
Yeah, I think from our perspective and being fully transparent, I think we were concerned about that as well from an advertising and ad ops perspective. But that group, to John's point, who was not used at all to working remotely, we kind of set them up, obviously, with the necessary technology, but also really reinforced the need to communicate on a daily basis in terms of priorities. And we haven't skipped a beat. It's been really, really fantastic.
Congratulations on your launch of a huge project. I'm sure that the stress levels during this pandemic have been off the charts. Let's talk about, medical communications, a ton of travel on the sales side, on the marketing side, on the content side. What's been the biggest difficulty there? And Joan-Marie, maybe you can go into a little bit more detail.
Sure. So I think the initial 4 to 6 weeks was just, we were kind of mired in the uncertainty of it all. There's so many medical meetings that happen in spring and summer. And we were watching as these large associations really had to completely reinvent how to put on a medical meeting. And so we had to use a lot of patience and reach out to our good friends at those associations so that we had that information as soon as possible. And really, we've reinvented ourselves in terms of how we are covering meetings. We're reaching out to key opinion leaders and the people that are the authors of the paper much earlier in the system and in the workflow. And they've been very wonderful because they have good clinical content that they want to get out. So they've been very available to us. They know that Healio always abides by embargoes. So they appreciate that, we have that relationship with them and we respect embargoes. And then long term, it remains to be seen. I mean, we're starting to watch fall meetings make decisions on whether they're going to have a hybrid of either, to have both virtual and live meetings, so that certainly we've had to become much more flexible and resilient in our patience in trying to figure out what's going to happen with all these major meetings.
Jason, we're on both sides of that as well. Our Healio Live group would be on Kiawah Island right now for the first day of Kiawah I, with about 600 of our good friends and attendees and exhibitors. That meeting's been postponed till the fall, so we've had to reinvent that. We've canceled one of our spring meetings that was right as things were breaking out in New York, and we've got another fall meeting and then several winter meetings that we're doing contingency planning for, not quite knowing what to expect. But everybody's been pretty wonderful with that as well. We've done a lot of outreach to our attendees, to our exhibitors and sponsors, and have found ways to make sure we're building value into the program, regardless of whether that can be run as our normal live event with virtual components or totally virtual. So we see both sides of that world.
When's the next time somebody's going to actually book a hotel or a flight? Is that still to be determined?
That's still to be determined. At this point, we've told people, you're going to be home through June. Don't worry about coming into the office. Don't worry about travel. There's really no place to travel to for the foreseeable future, so that's not a decision we need to make right now. Our fall meetings, 2 fall meetings, are planned to go on as scheduled or rescheduled right now. All the faculty have recommitted and plan to be at those meetings. There are no faculty travel restrictions that we've been informed of. The properties are reopening, so we're kind of taking it a step at a time. And we've told the staff that, hey, we're a traveling company, so at some point when it's safe, we're going to start traveling again. And we'll be in communication with you between now and then. And everybody's been pretty good with that.
Matt, we talked about a month ago on our roundtable about we're sort of in that I don't know phase. Have you guys seen anything in the last few weeks, budget cuts, budget reallocations, shifts of that nature?
We've not seen budget cuts. If anything, we've seen reallocation from what would have been more traditional digital display and digital programs. We've got people talking to us more about custom opportunities, especially around, to Joan-Marie's point, the cancellation of conferences where you were going to have a lot of data disseminated. How can we help them get that information into the hands of the audiences that they're trying to reach? Some of the specialties we're in that were really impacted by elective procedures, eye care and orthopedics, a little bit of a pause, but we're starting to see that open up again now that surgery centers and other settings are allowing patients in and providers in. So thankfully, being primarily a digital first organization, we've weathered this.
And as just a quick follow-up to that, again, have kind of heard that the messaging is kind of switched on the sales side to being more of a partner instead of trying to close new deals. Is that kind of what you guys are doing? Making sure that you're at the ready? Not to give away the secret sauce, of course, but...
Yeah, it's funny when John says that we're a traveling organization. I probably have a good half dozen salespeople that'll be the first person at Philadelphia or Newark Airport to get on the road and go see somebody. So the idea that we're not able to go and talk to clients has been an issue. Flip side of that, we're getting a lot more FaceTime and access with them because they can't travel either. So it's sort of this weird perfect storm. Yes, we've tried to be flexible in thinking about, they had a plan, right? They figured out what they were going to do for the year. And then all this stuff happened. How do you kind of course correct? How do you figure out how to get your messaging out in a way that is completely different than what you originally had scheduled? So yeah, we've had to be pretty nimble in terms of assets or materials or other things that they've got that we're trying to help them distribute. But you're right, it is much more, we're sort of all in this together, at least from a marketing perspective. So yeah, it's not pushing, it's more listening and sort of understanding.
And we've heard from across the industry that, digital engagement is up, some say even through the roof. Joan-Marie or Matt, can you guys talk about, what have you seen in your engagement and what are you guys doing to potentially capitalize on that?
So our active users on our website have gone up. The frequency at which they're coming has gone up, and the percentage of opens has increased. And all of that really surrounded around March 13th as we were producing a tremendous amount of COVID content and physicians were looking for a tremendous amount of COVID content, we were unique. They could certainly watch the lay press, but we were writing COVID content for the healthcare professional. And not just that, but we were writing it specifically. What does a cardiologist need for COVID? So we saw a tremendous uptick in terms of that content being consumed. I can tell you, we're starting to see a small drop off. I've gotten feedback from users saying that we have a signature email that goes out every single day called Healio Minute. They've kind of said, hey, that's enough. It's a lot of COVID. So we are certainly responding to that.
Joan's COVID-19 Resource Center. Joan, why don't you talk about that a little bit?
So we wrote our first article in early January when it was still an unknown disease coming out of China. And we used very generic terms back then. And so about 3 weeks ago, we hit the 500 item article mark in our COVID Resource Center. And it really, like I said, it does speak to the fact that we're not just writing generic COVID content, but we're being very specific. And we're also talking about not just the clinical components of it, but physicians' adaptation to, your podcast is called The New Normal, is how are they dealing with practice? How are they adapting telehealth? How are they changing what they did? I mean, in the time frame of like April, we had orthopedic surgeons that were on duty just to turn patients over in major hospital systems. So we were covering that type of stuff also because it's so significant to how practice was changing.
And from a corporate standpoint, we're fortunate with Healio Infectious Disease News. When this was all going down and we were making decisions to send folks home, we formed a COVID-19 committee and added Joan and Jared Gallagher, our infectious disease news staff writer, to that committee. They were talking to the leading infectious disease guys in the country and the world. And we were fortunate to have that kind of insight as we made our corporate decisions.
We'll be right back after a message from the Association of Medical Media.
Hi, I'm Jess Campbell from the Association of Medical Media. We're thrilled you're listening to our new podcast series, AMM Conversation. Along with our podcast, AMM is pleased to host a variety of resources for our members, located within the Knowledge Exchange on ammonline.org. Among these member resources are presentations and recaps from previous educational sessions, and our Medical Media Matters fact sheets that cover key topics underscoring the value and importance of medical publishing. The AMM is proud to be there to support everyone through these difficult times, and while we wish we could gather in person as a community, for now we hope you keep an eye out for our next virtual event. You can find out more, access our Knowledge Exchange, and become an AMM member by visiting ammonline.org.
We're back with the team at Healio chatting about the new normal in medical media. Let's get back to the conversation. Are there any conversations around, we understand some of this uptick is because folks are trapped, folks are in their homes or may have a little bit extra time on their hands, but have you talked about how we're going to, capitalize on this uptick, bring these users back more frequently, or make sure to engage the new users that we've identified?
One of the things I know you had hoped we talk about is, what have we done differently as a reaction to COVID? And one is this ability to harness the analytics that have been sitting there for, unfortunately, 6 to 9 months. With the new website, there is this keyword technology that is AI, but it's improved, but with human intervention. Well, we've been using that since September on the back end, and we've been harnessing these keywords to see adoption of, and the content needs of our physicians. So the fact that we're doing that now in the COVID world, that's great, but we now have that technology has become part of our DNA. And so we will continue to use that. So we're journalists, we've always reacted to the news, but now we can see not just what's important for the news at the moment, but are the physicians actually consuming that content? And we can be able to see keywords trend up and trend down and react to that. So that's just become now part of the news organization's DNA, which is really rewarding.
Sometimes good things come out of a crisis, right?
Yeah, I would agree. And I've also had this aspiration to, we're in large newsrooms, 60 people is not insignificant. And I always wanted to have a stand-up every single day. And to get 60 people in a room is a little unwieldy. but we adapted Slack chat. We have an 11:50 a.m. every day. People pitch story ideas. They're communicating, and we're able to collaborate on content. As medicine is expanding, it's also so much crossover content, and they're able to share ideas. We can have really important conversations about, say, telehealth that we wouldn't have if people were having them in each one of their smaller news groups. So that type of stuff, something I always aspired to have is finally happening, and we're using technology to make it happen.
Fantastic. John, I was going to ask you about a group or a department that's really surprised you. Do you want to talk about all the effort in the group? I'm sure that there's a core group and then a lot of others that have been part of your new platform.
It's Healio version 5.0, and yes, it is a large group. It's over 40 people in the core construction group, from our UX team to our UX design team, IT, of course, news, sales, and our audience development teams for over 2 years. And that's all coming to fruition now. It's all been finished virtually, which is amazing. And that's required tremendous cooperation, coordination, and communication to bring that project in on time. And to see everybody roll with the punches as the pandemic unfolded, change to a work from home environment, and still bring the project in as expected has truly been amazing and rewarding.
Matt, Joan-Marie, any other groups that you might want to highlight?
The one group that did not necessarily surprise, and I think that's important for us as an organization, is the sales team. I mean, so we actually already started, more of a flex schedule for them leading up to this. And I think that just got accelerated by the fact that, people couldn't go to the office and couldn't travel. So, what we've tried to focus on for them and for others is more structured, kind of regular communication. And so it creates some level of normalcy in the week with regular status calls and updates and that sort of thing. But from a productivity perspective, the amount of work they're putting through right now is probably at its peak or higher than it's ever been. So thankfully, we kind of had that mindset in place going into this. And so they're doing what they need to do. Again, the print advertising operations part of what we were doing is a little bit different because those folks had been in the office constantly. But again, we've not had any issues working with our printers, working with JoanMarie's team, making sure everything was getting done. I'd sing their praises, 7 days a week. They've done a fantastic job.
Christine Martinick, our advertising sales lead, said as this was unfolding that the sales team was as busy as they've been in peak RFP season. So again, incredible to deal with that. At the same time, you're making those changes to workflow.
Yeah, and it's again, one of those oddities of the slowdown. Work from home. John, you said you have 280 employees corporate wide. What percentage of those were work from home or flex schedule before? What are you looking for moving ahead?
Yeah, I would say sales, Matt, probably 50% work from home before this or flexible schedule. All of the Wyanoke Group has flex time throughout the year to some extent. So we've become accustomed to that. So the acceleration was somewhat natural, but also very rapid. And yeah, now we're asking the questions if people have been productive and successful for 2.5, 3 months at home now, how do you tell them they need to come back in the office? At least until we can all get in a room together and have a meeting. And there is no substitute for that. We do think that there's a time and a place for us to come back and be able to sit with each other. But it's not now, and it's not going to be for a little bit. When we can do it again safely, we'll do it. But other than that, it's tough to say, you're getting your job done, but we want you to come back because why?
Yeah, there's a report in Scholarly Kitchen that listed 10 reasons that you have to at least get to the office once in a while and be face-to-face, the micro interactions and support systems and those kind of things. What is the thought process with work from home, or have there been any specific issues with work from home?
There hasn't been any specific issues. In fact, like I said, we've really been excelling in this experience. We do tend to have personalities that like to talk to each other and like human interaction. And I think the longer this has gone on, the more I've realized it. And certainly in the very beginning of being on Zoom all day, people were just kind of getting down to business. And now you're starting to hear people chit-chatting about their dog and their kids and the weather, because I think people just kind of crave that. And the one special thing about Slack and Healio and Wyanoke is that there's a lot of people that have been working together for many, many years, and we have long histories with each other. We know each other's families, and to not hear those stories on a regular basis, I feel like that's, for me, what I'm missing out on, and I'm starting to hear that, from other people too. So I've definitely seen there's a little bit of tone difference in the Zoom calls, and just we want to hear how everybody's doing, and that's not a bad thing. And so I can't imagine ever being 100% work from home, because we still want to talk and see each other.
Matt, you've talked about Zoom fatigue.
Man, Zoom fatigue. Yeah, I think it's the idea that when we first started, everybody was really trying to be buttoned up about it and looking like we do now with collared shirts on. And now it's dogs barking, it's kids running in, grabbing homework off the printer, whatever it is. So I think, if anything, I think it's forced people to be a little bit more relaxed in how they communicate, which is not necessarily such a bad thing, because John talked about, the transition of the work part of this, but we've all had to deal with kids and parents and family and everyone else. So it's sort of, the idea of trying to get your day job done while life is kind of going on around you. I think, if anything, that's taught us all to be a little bit more flexible.
And grateful. I think we all, not just in the daily news, but in the headlines in our publication and the stories we hear from our KOL friends, there's a lot of people hurt out there, a lot of people suffering, and at times even feel a little bit guilty that we're doing as well as we're doing. But we keep keeping on, keep trying to support and help where we can, and take care of our folks.
It's interesting, to that point. I was talking to a friend of mine who works for a consumer digital health media company yesterday, and even you look at industries like travel and hospitality and automotive, who are really, really devastated by all this. And thankfully, what we do lines up with what's happening in the world. But even the consumer health company was impacted pretty negatively, because you're not going to market to a consumer in this situation who can't go to the doctor, who can't have a procedure done. So it, to John's point, it really kind of strikes a chord where you realize we've been very, very lucky kind of get through this, but get through it in a really good place.
I sit on the Coalition for Healthcare Communications executive board as well, and every couple of weeks we jump on a call. And as Matt just alluded to, if you're a healthcare company like the Wyanoke Group, and healthcare is all we do, we're okay right now. If you're part of a big holding company, consumer advertising has been affected the way it is. That has a trickle-down effect to our healthcare colleagues in those agency arms, and we're certainly hearing that.
Anybody worried that as summer's approaching, the temperatures are warming, schools and remote learning, thank the Lord, will be ending? Is there a little bit of concern that there might be just a little disruption might be coming, and might have to tighten the belts or focus a little bit more on organizational structure and getting the work done?
I would say the opposite. The owner and president, Peter Slack, has really been encouraging us to use our vacation and to not let the fatigue affect what we're doing. I mean, he's really, in fact, he does a weekly call that he records, and he was talking about Zoom fatigue just today. So we want people to start using their vacation and enjoying time with their family. We've always managed to, everybody got their vacation done in a calendar year, so we know we can weather it even in COVID. So
I think it'll be interesting, though, come September, or in October and November. And, we were having this conversation, Jason, with our kids the other night. It's like all of a sudden Memorial Day hit and everything's fine. And we're trying to explain to them that everything is not fine.
Yeah.
And nothing's really changed in the world in terms of vaccines and cures. But I think this has been a period that we've all gotten through. But you get back into school in September and October, and there's split schedules, it's online, or they're wearing masks, or that, I think, will be sort of, for us, at least in my opinion, second wave of how we then deal with all of that stuff, which I think is just going to be, new for everybody at that point.
Yeah, and one of the things with work from home, the research says that some employees get anxious about do my supervisors and colleagues think that I'm actually accomplishing my work? May not be the same in our industry as it would be if you're an engineer or manufacturing, but there is there is a connection.
I thought you were going to bring up were you talking to my wife about the fact that she actually wants to get into the office and talk to people, and she's sick and tired of seeing us. But I think what I can't speak for JoanMarie on this, but what we do is measured every day, right? Joan's generating people coming to our site, and we're hopefully generating sales and revenue. So you can't hide from that in terms of performance. So that's a good thing. It doesn't matter where you're doing it, as long as you're getting it done. And I think the idea that we can't really, or the issue we can't really correct for, is putting people together in one location. Which, to John's earlier point, I'm a relatively new at 2 years almost, and I've got people who I've worked with, or John and JoanMarie have been in for a very long time, who are used to seeing each other on a very regular basis. And so we can't really replace that, other than really trying to communicate, staying in touch with people, and then really staying attuned to good days, bad days, and how people are acting and reacting, and making sure that you're sensitive to that. But it's hard. I mean, from a physical sort of in the office sort of company, to be able to correct for that, you can't, unfortunately, at this point in time.
Yeah, early on, we asked managers to make sure that they were staying in contact with their staff on a regular basis, a more regular basis even than when we were in the office, that we were sending out those messages about take a break when you need it. Don't let this get to you. We understand that things are different. Show more flexibility, and share a little bit too. And let people know that we all have our good days, we all have our bad days, and that's okay. And to reach out when you're feeling that way. I was surprised as we talked with people, you talk about kids in school and parents and things like that. The folks that I found were feeling it the most were young folks on their own, living alone, and stuck in their studio apartment or one bedroom apartment with really nowhere to get away from work, and one day blending into the next. So we're trying to be aware, especially of folks like that, and make sure we don't leave them alone.
That is all for this episode of AMM Conversation, official podcast of the Association of Medical Media. Thank you for listening. Make sure to join us next week as we continue exploring the new normal in medical media with Elsevier's Dennis Conlon, Alejandro Alvarez, and Sumner Mary. More information on the new normal in medical media is available at ammonline.org. Make sure to listen and subscribe to the AMM Conversation podcast on Apple Podcasts, Spotify, Stitcher, or wherever you enjoy podcasts. The views, thoughts, and opinions expressed in this podcast belong solely to the guests and not necessarily to the host, the Association of Medical Media, or any other group or individual.